In this anxiety skill building exercise, we're helping the patient not only regulate anxiety, but see what causes it. If the patient doesn't see what causes his anxiety, unfortunately, he may think that you are causing it, and then he'd be at greater risk for relapse and dropping out. We know that the dropout rates for patients vary anywhere from 30 to 60%, actually, depending on the treatment setting. So being able to regulate anxiety and helping the patient understand what makes his anxiety helps you co-create a safe place where he can feel comfortable and know what's going on. So in this example, we'll just show how we do that. So, what's the problem you'd like me to help you with?
I feel sick to my stomach.
Thank you. Yeah, so that's a sign of anxiety. Yeah, and so what we're noticing as you come here, you're wanting some help, and something about wanting help makes you anxious, and then the anxiety goes into your stomach. Do you see how that just happened here?
Yeah, I guess so.
Yeah, that's something about, you're just wanting help,
Yeah.
and something about wanting help makes you anxious, and then when you get anxious, then it goes in your stomach. Yeah. Well, what's it like to just notice that when that happens there?
I think I feel a little bit more anxious now that I'm noticing it.
Yeah.
I can really feel it in my stomach.
Wonderful, because you're more aware of it. Exactly. Before you weren't aware, now we know it's aware of it, and now we can notice that there's something about just simply coming here for some help. Yeah. We don't know why, but something about coming here for help makes you anxious, and then we see how it goes in your stomach. You see that too?
Yeah.
Great. Good. Now, that's probably a new skill too, isn't it? That's probably a different way of dealing with it.
Yeah, it's really interesting, John, because I remember, again, starting to do this kind of work.
Yep.
Anytime you start to try to do something different, every time I started justifying, like, well, this is weird, it's uncomfortable, it's new. Like, I would find out all these different ways to not deal with my own anxiety as a trainee.
Yep.
Right? To start to be more active in session.
Yeah, well, I had trouble being active, actually, because in my initial training, I did psychodynamic psychotherapy, right? So I was very quiet. And there's times to be quiet, of course, with patients, but the problem is when the patient was anxious, I'd be quiet, and if I was anxious, I'd be really quiet.
Who was more anxious in the room?
Yeah, well, yeah, that's, sometimes it was me. So, but the fact is that being quiet would be one way of dealing with anxiety, but the problem is if the house is on fire, the patient needs someone to help put it out, and he needs some help to make sense of it. So in a sense, when we're learning new skills, yes, we're becoming more active. And in my experience, when I became more active, that was different than my customary way of working. It was different from my habit. And since it was outside my habit, I became more anxious doing something new, being more active. It was new, it was unfamiliar. And so, you're right, I would get more anxious being more active.
I also feel that whenever we start to do something new and become more active, it becomes very clear our limitations. We try to put things into words, but we don't really know how to say things. So it makes everything so much clearer about our own growth edge.
Exactly, because we know what to say, what we always say, right? There are certain statements we make in every session. We know how to say them. Piece of cake. Don't even have to think. But when we have to say something new or different, yeah. I mean, even when I was learning dynamic therapy, there's a kind of thing where you talk about the relationship in a particular way. It made me so anxious, right? Because it was so different, right? And so here, likewise, too, as you're learning these skills, some of them will feel unfamiliar because they're new, and you're going to feel uncomfortable because sometimes you don't know what to say. You forget what to say. And because they're new skills, yeah, you're going to forget them. In a sense, you could think of it like learning a new language. You read something in a book, you practiced it, and then suddenly when you're in conversation trying to speak Spanish or French or whatever the language is, you get stuck. You can't remember that word, you can't remember that phrase, you don't know how to conjugate the verb. And here we're helping you learn to speak a therapy language. And the same things happen. It's totally normal. So if you get flummoxed, you have trouble finding your words, you're not sure quite how to do it, join our club. It's the normal process of learning. We always fumble a little bit. That's why we have these exercise repeat, because if you repeat them enough, you eventually learn the words, and then they'll feel much more natural, and they'll come out of your mouth, and they'll really sound like you.